Hello, it's Adam here from New Forest Physio Clinic, and in this video, which is part of a video series on knee replacement surgery, I'm going to talk about why somebody would need a knee replacement and arthritis. So arthritis is where the hyaline cartilage, which is a rubbery surface that lines the surface of the joint, when that's worn out. So if we look at the skeleton, on the surface of, this is the femur bone, on the surface of the femur here, at the back of the patella, which is the kneecap, and on the surface of the tibia, there is a thick rubbery material that is hyaline cartilage. Now, with age, what can happen to that cartilage? It dehydrates and it wears down. Also with trauma, you can put dints and damage on that hyaline cartilage. But usually with age, what happens, it just gets thinner and thinner, and eventually it gets right the way down to the bone, and pressure starts to be put upon the bone and you start grinding into the bone. And that's what we would call arthritis. And as I said earlier, the other way of getting arthritis is if you traumatically take a chunk out of the hyaline cartilage, and that would also cause arthritis. I've got a picture here on my computer screen. So this picture on the left here, this is the femur and the tibia, this is the lower part, and the fibula. And in here, on an x-ray doesn't show hyaline cartilage. This space isn't actually a space, this is where the cartilage is. And this, on a normal knee, you can see a nice big space there, and the bones are all nice and smooth on the edges. In this image here, the person has got arthritis, and we can see on the inside of the knee, which incidentally is where arthritis normally affects the knee joint, is on the inside initially. That tends to be the part of the joint that goes first. We've got kissing bones. In other words, the bones appear to be touching, because they are touching, because the hyaline cartilage has worn right the way down. There's a space here, normal joint, no space here. This joint will also start to buckle, and there's a chance this person would be bow-legged, because the joint buckles in, so it gets wider this side and narrower this side. Now, once you put pressure onto the bones, they start to grow extra bone to try and reinforce themselves, and that extra bone causes bony spurs. And on the edge of the joint here, we can see bony spurs. So joint replacement surgery, the way that works is it literally just cuts. If I come back to the skeleton here, in joint replacement surgery, if the diseased part of the joint is literally cut away, so they literally just slice the end of the bone off here and slice the end of the tibia off, and it is replaced with a metal, usually titanium, replacement. They can do what we call a unicondylar replacement, which is half a knee replacement effectively, usually the inside compartment, where they just cut off this part of the bone, so the inside part and the inside part of the tibia, and then that's replaced with a unicondylar knee replacement. So that's why you might need a knee replacement. And in the next video, I'm going to talk about the kinds of things you can do at this stage prior to surgery to help yourself. Thank you.